Some of our hospitals are behaving in a way that, if not legally criminal, certainly is morally criminal. Check out this rant on that. Let me know what you think about it. You leave your comments, ding the bell, share it with your friends, and subscribe to our channel. I spoke briefly, I suppose, about the criminality of the Trump administration and how they're basically letting people in blue states die so that they can send personal protective equipment and ventilators and things to red states. And we now have, a confirmation of this from an unknown source inside the White House. Meanwhile, we're seeing, I think, frankly, at least morally criminal behavior on the part of some of our hospitals. This is amazing. Nick Kristof in today's New York Times, or yesterday's New York Times, the article is titled, "I do fear for my staff," a doctor said. He lost his job. That's the headline. And Nick Kristof points out at least 61 doctors and nurses have died from the coronavirus in Italy so far. In New York City alone, 2 nurses have died. This is in the United States. In New York City alone, 2 nurses have died and more than 200 healthcare workers are reported sick at one hospital. And all this is because we don't have adequate personal protective equipment. In Bellingham, Washington, an ER doctor, a fellow by the name of Ming Lin, had worked for 17 years at Peace Health St. Joseph Medical Center. 17 years this emergency doctor has worked there. He went on news and said he went on the news and he was interviewed by the TV station and he said, "I'm concerned we don't have enough personal protective equipment." And Charles Prosper, the CEO of the hospital network, who's refusing to take Nick Kristof's call, "Charles, you're a friggin' coward." Charles Prosper, the CEO of the hospital network, would not even take a call from a reporter. The board of directors needs to fire this ass. Anyhow, he fired this ER physician. He fired him because he went on TV and said, "I don't have enough PPE." I don't know how to reach the Peace Health board of directors, but if I knew a way to get to that board of directors and suggest that they fire Charles Prosper, the CEO of the hospital network, I would do so. If you know how, maybe you can call in and let me know. In New York City, Dr. Anna Ringswelsky, an ER physician, brought her own PPE. She works at the Weill Cornell Medical Center. The hospital refused to allow her to wear it and sent her home. Her future is unclear. In Chicago, a nurse, Lori Mazurkiewski, I'm sorry, I can't pronounce her name, but anyhow, Lori warned colleagues that standard face masks distributed by the hospital were not safe. She brought in her own higher grade N95 mask, and she was fired by Northwestern Memorial Hospital. Does anybody know who the CEO of Northwestern Memorial Hospital is? This is obscene. In Texas, an anesthesiologist, Dr. Henry Nissis, who was in effect suspended without pay. I'm reading from Nick Kristof's piece in yesterday's New York Times. Was suspended without pay because he wore a mask in public places in the hospital. Nick Kristof says it's baffling that the richest country in the history of the world fails so abysmally at protecting its health workers, especially when it had 2 months lead time. And for hospitals to now retaliate, this is both unconscionable and idiotic. And obscene. Meanwhile, Senator Bernie Sanders is demanding that postal workers have access to sanitation products and personal protective equipment. He cited a report from ProPublica earlier this month that said that the Postal Service was pressuring its workers to keep delivering the mail even when they have symptoms of the illness, and that they had little to no access to hand sanitizers. Over 200 U.S. Postal Service workers have tested positive. That's as of Tuesday. That's 3 times as many as the previous week. Now, that's out of 630,000 workers, but still. The U.S. Postal Service told Huffington Post, though, that they are now starting to make masks and gloves and surgical masks available to all employees. And also that they said they have a coronavirus-related paid leave for workers to use for childcare if they come into contact with someone with COVID-19. So maybe, Bernie is starting to shake things up. Meanwhile, we're discovering that on February 3rd, now get into your Wayback Machine, February 3rd, the first confirmed death or the first confirmed case in the United States and South Korea was January 20th or January 19th. February 3rd, about a week and a half later, the U.S. Army warned Donald Trump in an unclassified briefing on February 3rd that 150,000 Americans could die because of COVID-19. This is the Army. They gave this, this came out of U.S. Northern Command, NORTHCOM, and it came 2 days after Defense Secretary Mark Esper ordered prudent planning for a military response to COVID-19. So the Army, Secretary of the Army asked for it, the Army provides it. They say 150,000 people are going to die if you don't do something immediately. And what did Trump do? Nothing. This is in February. It's now April. We still don't have a nationwide shutdown. This was in February. February 3rd, in fact, almost the end of January. Trump knew, Trump lied, Americans died.